Hi all, my name's Dr. Justin Amery and I'm doing a series of video YouTubes on coronavirus, hoping for the best but preparing for the worst. In this particular video, I'm going to be talking about death and dying, the actual process of dying and death itself. This is not an easy topic. I can't make it easy, but I can guarantee that if you watch this video, I'm almost certain that by the end of it, you'll feel more comforted than you do right now if you're worrying about death and dying from coronavirus. Because, in my experience, the fear of death and the fear of what might happen is very, very rarely worse than the reality. So today we're going to be talking about death and dying. Just a little bit about me. My name is Dr. Justin Amery. I'm a family doctor or GP working in the UK. I'm also a specialist in palliative care, particularly amongst children, but also in adults. I spent 25 years doing that both in the UK and abroad, particularly in Uganda. And I'm currently sat at home recovering from coronavirus and wanting to do something, because it seems to me from talking to my patients and people I know, there's a lot of fear out there, and it's particularly with social isolation. There's a lot of elderly people alone and frightened, and the aim of these videos is to give comfort, partly because for the vast majority of them they're going to get through this okay, and for those who don't, there's lots of things that we can do to make sure that the time they have left is peaceful and comfortable and dignified. There's a lot we can do to help. The key thing is to understand about what actually happens when I die. That's what we'll be talking about in this video. If you think this isn't the right time for you, or this is a bit much, just turn off. It's going to be up on the internet, so you can always come back to it another time. If in the middle of the video you feel it's too much, just turn off, because it's going to be on the internet and you can come back another time. So when we're talking about our own deaths, it's not a pleasant thought, but one of the good things about thinking about your own death, and let's face it, we all know it's going to come to us one day. One of the things about thinking about your own death is it really puts things into perspective. And in fact, often with patients who are struggling with anxiety or uncertain about things to do in life, I often invite them to imagine that they're on their deathbed and thinking about the things that they will regret having not done and the things that they'll be really pleased they have done. And when people are on their deathbed in their imagination, pretty much nobody ever says, do you know what, I wish I'd worked harder, or do you know what, I wish I'd made more money, or do you know what, I wish I bought more stuff. That's not the case. Pretty much everybody says the same thing. You know, I'm so pleased that I had family and friends that I could love. I really enjoyed those tremendous experiences I had. The experience of being alive and being part of nature, and just the incredible nature of existence. Those things are what makes life special. And if you're watching this video right now, every single one of those things is still available to you right here, right now. Your life is still going, and you've still got time to make good decisions and enjoy what's left of it. So ask yourself, what's most important to me? What's most important to you now? And let's say the worst does come to the worst and that you succumb to the coronavirus sometime in the next few months. What will be important to you then? What do you want to have happen? And prioritize those things. You won't have wasted your time. It'll be really important time well spent. But let's go a bit further. I'll go a bit deeper. I'm going to talk a little bit about what people are frightened about death and dying. Well, there are pretty much, I've asked this question all around the world, literally on every continent of the world. I've asked this of health professionals and patients. Is if I told you that you're going to die tomorrow, what would you be most worried about? And people tend to say one of three things. It's, will I suffer? Will it be painful? Will it be undignified? Will I be frightened? So will I suffer? They will also ask, what's going to happen to my loved ones? Who's going to look after the people I love when I'm gone? What will happen to them? And then the third thing is quite practical stuff. It's like, what needs to be arranged? What's going to happen to my will? How do I arrange my funeral? How do I get my affairs in order? And it doesn't, honestly, anywhere I've gone, and where people who are wealthy and people who've got almost nothing, in Western civilizations, in elder civilizations, it's the same. One of the things about death and dying is it unites us. It's like being born and being alive and dying, what brings us all together, what makes us all human, and what gives us all a shared experience. So I'm going to go through each of those 3 questions. First one is, will I suffer? Let's go straight for the hard one. If you get coronavirus, will you suffer? Well, of course, there's a mental suffering of the sense of, I think I'm not going to get better from this illness, or worse still, that I might die. But from a palliative point of view, the symptoms that you might get from coronavirus, if you're dying, are really, really easy to treat. And I'm not just saying that to try and comfort you. That's not what I'm about. I'm about telling things honestly, gently, comfortingly if I can, but honestly. But the symptoms you'll get if you have severe coronavirus is maybe some breathlessness, maybe a tightness in the chest, some mental anxiety, a cough, and then perhaps as you get more unconscious, a bit of rattling in the chest. But pneumonia, chest infections, have been called the old man's friend for hundreds of years, and for very good reason. That when you get a chest infection, when your lungs begin to fail and the amount of oxygen in your blood drops off, and your brain then just becomes more and more sleepy, and you drop into a sleep, the sleep gets deeper and deeper, you become unconscious, not rousable, and eventually there's not enough oxygen to sustain your heart and your brain, and you stop breathing and you die. So for the vast majority of people, dying of pneumonia is not an experience that causes physical suffering. Even in the period where you might be getting some symptoms like breathlessness or coughing or chest tightness or anxiety, they're really, really easy symptoms to treat from a doctor's point of view. We can use a little bit of morphine, which you're probably thinking, morphine, crikey, everyone's frightened of morphine. People think of morphine about drug addiction, or they think about euthanasia, or they think about that terrible doctor, Dr. Shipman, who gave morphine to his patients to kill them. The fact of the matter is, morphine, as long as it's used correctly, is an incredibly safe drug. Far, far more safe than, for example, other painkillers that we use all the time, like paracetamol or ibuprofen. Morphine is a very, very safe drug, and you only use very small doses for breathlessness. It's also great for pain. Diazepam, which is a common drug, sometimes people know it as Valium. That group of drugs called benzodiazepines, fantastic. They get rid of anxiety, they get rid of a sense of breathlessness. There are other drugs we can give you to get rid of rattling in the chest. So they're not difficult things to treat. There's absolutely no reason, I'll say it again, there's absolutely no reason that if you have a good care plan in place that you'll suffer, even if you do die from coronavirus. A harder question to answer is, what will happen to my loved ones? I can't answer that question, but you can. What will happen to your loved ones? Have you spoken to them? Do you know what will happen to them? Have you got a plan in place for them? If not, now is the time. If you're like me, I suspect most people are probably the same across the world, there'll be things that you haven't said that you wish you'd said, things you have said that you wish you hadn't said, people you haven't seen for a while, people you haven't reached out to, people you feel regrets about. There's maybe things you need to make amends for, particularly loving connections that you've not yet made, or you just need to reinforce or restate. The best thing you can do for your loved ones is those things. Of course, there's some practical stuff that we'll come on to in a second, but take this opportunity right now, turn this coronavirus epidemic into something positive by doing something good, reaching out to the people that love you, having them reach out to you, and talking to them about things that you need to talk to them about. And be honest. Don't be embarrassed, and don't be shy. Don't be stiff upper lip and British. Just tell her how it is. If you love someone, tell them you love them. If you're sorry, tell them you're sorry. Finally, practical matters. How do I deal with practical matters? Well, practical matters are very practical, so we can be quite practical about them. Just get a pen and paper and write down what stuff do I need to do to get everything in order before I pass on. It might be writing a will. When we write wills, we often think about money and insurances and possessions, and those things are of course really important, particularly if we have dependents who are going to rely on that once we've gone. So if you don't have a will, write one. You don't have to go to the solicitor, you can get them online. Just get something written. Get someone to help you write it if you haven't done that. Perhaps even more importantly, as I just mentioned, the things that you haven't done and said to people you love, get those done and said, so you pass on good memories when you've gone. And think about making memories. Is there anything you want to do that you haven't done? Any particular memories you want to make or to share that you can get on with? Focus on those things right now. And then the practical stuff, just make sure you've thought through, okay, if someone was having to come into your life and sort it out once you've gone, what's going to be the difficult stuff? Have they got the PIN numbers to your bank accounts? Can they get in? What do you want to have happen to your stuff? Those are very practical matters. Doesn't matter too much because they're just matters, but still, they do matter. What happens after? I have no idea. I wish I knew. Some people are religious, some people are not religious. I myself, somewhere in the middle, really. I'm a Quaker, which means that we don't really know exactly. But personally, I think there is something bigger than ourselves. Some people might call it consciousness, some people might call it God. Some people might not call it anything. What I do know is, having watched many, many people die, is, and this is where I think I can be very reassuring to you, is death itself, at the moment you die, is not an unpleasant thing. It is as simple as falling asleep, and it's as painless as falling asleep. As someone once said, it is easy as stepping off a log. Death, after a period of illness, is usually a release. What comes after, who knows? Maybe we just evaporate back into the ground, and at least our atoms and our molecules are resurrected into other people and other life forms, and we live on. Certainly, we live on in the memories we've created, in our legacies. So that's something to be comforted by. Maybe there's something even better, who knows? But right now, I wouldn't worry about that. Let that take care of itself. Focus on the time you've got left. Enjoy your loved ones. And try not, above all means, to be alone. Because I've never met a single person who wants to die alone. I certainly don't want to die alone. But the fact of the matter is, particularly in Western society right now, with all that's been going on over the last 10 years about people being outsiders and walls going up and them and us, and the way that our society in the West particularly is fragmented, so that our elder population are in care homes or living alone. There are a lot of frightened, lonely people out there. Many of us have family, and we should be very fortunate for that, and we should be grateful for that. A lot of us don't. A lot of us have nobody. And for those people, the prospect of dying with coronavirus is particularly frightening. And for those people, I would say, one thing I've learnt in my life as a doctor and anywhere else is that 99% of people are caring. They're kind. And you can rely on them if you reach out. But most of us are too proud or too frightened or too stubborn or too whatever to actually reach out. Because even if you don't think you've got someone, even if there's nobody you can think of that you can rely on, I can absolutely guarantee you that if you reach out and you tell people that you're lonely and that you're scared, someone will be there. Talking always helps. talking always helps. One of the lovely things about this horrible situation is just seeing people stepping forward after a decade of people dividing up. This seems to be a real impetus of people coming together, and there's volunteer networks everywhere. You can get on the phone, you can get online, you can open the window and shout out the window, please would someone come and help. It could be your neighbour, it could be your friend, it could be a doctor, it could be your local counsellor, it could be one of the voluntary services, someone on the telephone. I can guarantee if you ask, help will come. So don't be proud, don't be stubborn, don't be frightened, reach out. Please, please, please reach out. If you reach out, someone will be there. If you're a young, healthy person and you're wondering what you can do, reach out. Find someone who isn't. Get together and help each other. You'll be pleased to know that's the end of this video. It's been a long one and a tough one, talking about death and dying. I hope you found it comforting that if the worst comes to the worst, you won't suffer. You won't be alone. You can have people around you. You have choices. You can get your matters together and you can get your matters organised. And at very least, you'll leave behind memories and legacies, and you will live on. Ultimately, we don't know who's going to survive and we don't know who's going to die. There are some things that aren't in our hands. I don't know if you're religious or not religious, but this kind of prayer or statement is agnostic. Doesn't matter if you're religious or not, because I think it applies to everybody, which is grant me the serenity to accept the things I can't change, the courage to accept the things I can, and the wisdom to know the difference. And that's what I hope this video has helped with. It has given you the serenity to accept things you can't, courage to face up to things that you can change, and wisdom to choose to do those things. I hope you found this video helpful, and most importantly, I hope you found it comforting. Please do go ahead and watch the other videos, particularly the next one, which is about how you can plan. It's a much more practical video. It's nothing like as difficult as this one. It's just more practical stuff that you can do to make sure that if the worst comes to the worst, you've got a good plan in place. Most importantly, please, please, please share this video with friends and family, because it's very important, as this virus is moving quite quickly, that everybody gets a chance to think about this and to plan so that they can have the best life possible, and hopefully not, but if it comes to it, the best death possible. Thanks for watching and take care.